Okay, injuries and disorders of muscles. Um, some of these you're probably already familiar with, having dealt with them yourself, um, but some of them are probably a little more uncommon. Um, so the first muscle injury that we'll talk about is a strain. So if you remembered when we talked about bones and joints, we talked about sprains. So those were stretching of the ligaments. Now we're talking about strain, which is sort of the muscle equivalent of that. So it's a muscle that's stretched beyond its usual limit. So there are some levels of strains. Grade 1 is just painful. Probably everyone has experienced at one time or another a type 1, grade 1 strain, where it's just painful. A grade 2 involves pain and weakness, so the muscle is not able to work as effectively as it normally would. And then grade 3, which I'll see in a second, involves loss of function as well because of the severity of the trauma. So here you can see again the different grades of strains. So grade 1 is a pull, which again probably everyone has experienced a muscle pull of some kind. With a grade 2 stretch, there's actual tearing of the muscle, so you can get a lot of bruising from that because there's a lot of blood flow. And then grade 3, this is very severe. So this, remember, it causes loss of function. So this is what's called an avulsion, where there's an actual disconnection of, here it's the tendon. But so the muscle is actually split in some way. And so clearly, if it's not connected, it's not able to function. We can also see contusions. So these aren't just muscle injuries, although a lot of times we see them muscle related applications. So a contusion is a bruise, effectively. So blood vessels burst. So here you can see blood will leak out, and then you can see the blood through the skin, and it makes a bruise. You can also get deeper contusions where you wouldn't be able to see them, but something similar would happen. Blood would leak out, and that would cause a painful area. Bones likewise can bruise, and here we see the tibia and the femur, and you can see there's some bleeding there, so the bone itself is actually bruised. And that's a contusion or bruise. Next, we have a muscle cramp. So muscle cramps occur when voluntary muscle, so skeletal muscle, contracts involuntarily. So the cause of muscle cramps isn't totally known. They do know that it's affected by dehydration or electrolyte depletion. So making sure you stay hydrated, having plenty of electrolytes. Sometimes people say, like, eat a banana to help prevent like foot cramps in particular, because bananas have electrolytes. The other thing that can cause the muscle cramping is inadequate stretching or fatigue. So in the last part of the unit, right, we talked about um, muscle, like the ways muscles use energy. And so as you get to the limits of that energy usage, that can also um, lead to some muscle cramping as well. So stretch, stay hydrated, and hopefully you will not have to deal with muscle cramps too much. Okay, so next we have DOMS. Again, this is probably something that many of you have experienced. DOMS is an acronym. It stands for Delayed Onset Muscle Soreness. And I hate to tell you, but as you get older, this happens more often. They, again, don't really know what causes this delayed onset muscle soreness, but they think that it's maybe due to tiny tears, microscopic tears in the muscle tissue. So when you exercise, you can get, little tiny muscle tears, which is part of why muscle builds and grows bigger. So they think that that might be the cause of this delayed onset soreness. They do know it's not a result of lactic acid buildup. That's a more immediate soreness. Okay, so next is tendinitis and tendinosis. So tendinitis, you recognize the itis suffix. So this is inflammation of the tendon. That is not spelled right, but you can still tell that it says inflammation. So that is when, a tendon gets inflamed. So this is extensor tendinitis, what you're seeing here. So the muscles that extend the wrist. With usage, they can get inflamed. Any sort of repetitive motion can cause this tendon inflammation. Tendinosis occurs when tendinitis is untreated, it's more severe, and this leads to degeneration of the tendon. So if you think back, like when we talked about osteopenia and osteoporosis, osteoporosis was worse, more degenerative. Here, tendinosis is more severe than tendinitis, but both involve inflammation of the tendon. Okay. Next, we have sort of a group of common injuries of the shoulder. We talked about the shoulder joint being fairly mobile and thus fairly easy to damage. And so rotational injuries of the shoulder, because of the way the socket is, are fairly common. These can occur from either injury or degeneration over time. And they're common rotational injuries, so like injuries to the rotator cuff, the muscles that surround the shoulder and kind of help hold the humerus in place. They're common in athletes. So swimmers, for instance, throwers, things like that can easily damage those shoulder muscles. Construction workers, because of the lifting and hammering and things that they do, they're putting a lot of strain on those muscles. There's also a genetic component, they think, just because some people, um, the way your body is built, might have better or worse sort of connection in their shoulder. So, fairly common injuries for people who are doing a lot of repetitive shoulder motion. Another common joint muscle injury is epicondylitis. So on your elbow joint, to epicondyles, medial and lateral epicondyle, if you kind of feel your elbow, you'll feel sort of those two bumps on the inside and the outside of your elbow. So often this is called tennis elbow epicondylitis. And what happens is the tendon that stretches over the epicondyle, over that bump that you maybe just felt, it can get inflamed because it's rubbing there. And if you're doing repetitive injury, like playing tennis, for instance, it can get inflamed and it can tear potentially. So, like I said, it's often called tennis elbow. For baseball players and like little league players in particular, they tend to get medial epicondylitis. So little leaguers tend to get medial epicondylitis, so on the inside of the elbow. Tennis players, as you see, they tend to be lateral epicondylitis because of the way the motion occurs. And then golfers, because of the way they swing and follow through, it's more common for them to get both medial and lateral epicondylitis. So, I'm sorry, golfers. So, shin splints are sort of the common name for medial tibial stress syndrome. So, what happens is that, especially if you are starting an exercise regimen, if you've like taken a long break or not done it previously, or if you're wearing improper shoes or old shoes, the muscle, the bone, the tendons in the leg become sort of overworked because of that repetitive activity. And so that creates this medial tibial stress syndrome. It's usually sort of on the inside of the tibia. That's why it's medial tibial stress syndrome. So anyway, shin splints, not fun. Next, we have whiplash. So whiplash occurs, often it's associated with like car accidents. And so this is caused by hyperextension, as you see here. So head snapping back and then snapping forward. So it's pulling on that C-spine, the cervical spine. These are the cervical vertebrae. So the muscles and tendons are getting pulled kind of very quickly in opposite directions. And so that can really be painful for the neck, and also, I mean, it can be very dangerous because of the spinal cord running through there. Okay, so next, this slide just represents a variety of types of muscular dystrophies. So muscular dystrophy is kind of a broad term that relates to many different specific conditions. All of them are related in that they uh, cause muscles to damage and weaken over time. So there's a protein called dystrophin that is critical in muscle contraction. And so these different muscular dystrophies have some genetic issue with that dystrophin protein. And so, depending on the specific type of muscular dystrophy, um, different muscle groups will be affected, and they can be affected more or less. So, it can be less severe or more severe. But in general, they all are going to cause progressive weakness, progressive loss of muscle mass, because the muscles aren't able to contract because they're missing that protein, or the protein isn't formed correctly. So it's a genetic problem. It starts in the DNA, and then because DNA codes for protein, the protein doesn't look and work the way it should. So hernia is an injury where some tissue, usually abdominal tissue, a lot of times it's the bowel or the intestines, which sort of pokes through the cavity where it's supposed to stay. Oftentimes they involve the abdomen or the groin. So there are different types of hernias, depending on like the location and the cause, but they're all basically the same thing, just different locations. Some part of an organ is protruding where it shouldn't be. It can be very uncomfortable, and it can be problematic if blood flow stops, so that this part of the intestine, for instance, wouldn't get blood flow, and it would get what's called a strangulation. So it could die, and that can cause lots of issues. Hernias can be caused by many things. Oftentimes there is some sort of like heavy lifting involved. Often there's some sort of like genetic predisposition or previous like surgery or something that might have caused a weak spot in the wall, and that would then make a hernia more likely. Okay, last thing. So this is not in your book, but because we all sit in front of our computer so often, lower back pain is a very common sort of result of modern lifestyle, because these muscles in the back that help us stand up straight, our postural muscles, when we sit and sort of hunch in front of the computer screen, they aren't being used in the right way, and so they can get strained, and then they hurt. So take care of your spine, as well as the rest of your muscles, and you hopefully won't have to deal with any of these. All right, thanks guys. Bye.